Okay, so now that you've admitted, discharged, and transferred a patient, right, we're going to talk about different ways that we can position our patients, turning, why we do those things. We're going to transfer from the bed to the stretcher. It's a team effort. Okay, it's a team effort when we do this. So I will show you that. I just have it out so that you can see it while I'm talking, right? And we're going to talk about all of those things, and there are a couple different skills within this PowerPoint. So this PowerPoint's a little bit longer, but it'll make sense, okay? So at the end, you're going to know how to properly position the patient in good alignment. You're going to know what that means. You're going to know how to turn them, how to move them up in bed, and still maintain your own good body mechanics, because that's huge. Because nurses have what as our biggest problem when we're working?
Posture.
Back pain, right? So this is all part of our body mechanics. And then you're going to know how to position the patient into a wheelchair, dangling them on the side of the bed, the stretcher, all kinds of fun things. Okay? So like I said, there's a lot of skills that go along with just transferring. So, why do we turn a patient?
To do temperature maybe? Wow, you use my Senga.
To do temperature maybe? If I have to take their rectal?
Any other they're vomiting.
If they're vomiting, if they have any injuries. Anybody ever thought of maybe they can't turn themselves? Any of you laid in the same position for more than a couple of hours? Does your body hurt?
Yes.
Okay, so some people are paralyzed, or some people are just lazy and don't move themselves. And so it's your job to make sure that they're moving in the bed and in chairs. So just because they're up in a chair doesn't mean we still don't position them every couple of hours, and we'll talk more of that. It is legally your responsibility to make sure that they're safe at all times. So legally you're responsible to keep them safe. So safety includes they have socks and shoes on. They have bed rails up if they're supposed to. The wheelchair is locked if it's supposed to be. So we are responsible for those things. And then we're also responsible for ourselves to make sure that we're using good body mechanics. And as we start lifting each other, you're going to find out what I mean more when we're getting there. So alignment is a big thing that, I thought there was one more, that we will talk about. You will have to always maintain good alignment for your patient. So alignment means positioning the body so that the head is in line with the spine. Okay? So how many of you lay like all kinds of crooked in bed? And you're comfortable, and that's fine, right? But are our patients comfortable like that? No. So we have to keep them with their head and their spine in line. So when we put them in bed, I'll show you how you're going to do that when we start moving around more in the bed. But we're preventing fatigue on our muscles, because you get tired of laying like that, all hot mess, right? And it prevents, these three things are exactly the same thing, and I've got some ugly photos here in a second, so prepare yourselves, okay? Just in different terms, because we call them different names. So, decubitus ulcers, also known as pressure sores, also known as bed sores. How many of you know what any of that means? Nobody?
I think I've heard some.
You've heard of some of them, okay? So these are things that happen very often. These are the most things that happen to a patient, bed sores. This is from lack of turning them or repositioning them. It's the only way a patient's going to get it. If they come from home, they were lazy and never got out of their recliner on their own. If they came from a nursing home, the aides were lazy and didn't turn them. Okay? If you're working in a hospital and you get a patient from a nursing home and they have bed sores all over them, you'll know right away if that's a good nursing home or not. How?
Because they weren't turning them.
Because they have bed sores or they don't have bed sores. Okay? You'll know right away which nursing homes are good and which nursing homes are not. And when you start working at them, you'll know for the same reasons. You'll see patients with these things and you'll wonder, what the heck happened? And I'm not saying all of it is because of the aid, because sometimes patients just won't turn for you. Or they go right back into the same position. But you have to chart that. If it's not charted, then it's on you, not the patient anymore. Okay? It prevents contractures. We're going to talk more about contractures in the next couple of slides, or like next couple of topics. But contractures are basically when your muscles just get stuck in a position. So how many of you have seen people, it really happens to people in wheelchairs, their arms like get stuck like this, and When you go to dress them, you're like literally ripping their arm out because their muscle doesn't want to move like ours does. Okay. If you would move their arm that much, you would probably rip their muscle out because their body only is going to move like this. That's it. Okay, their muscles just tighten. And when you don't use your muscles, weird things happen to your muscles. They shorten. Okay, so they start out this long, and as you don't use them, they start to shorten, which is contracting them back into your body. So you don't get to pull it out that far anymore because there is no muscle to pull that far. Okay, so if you don't use it, you lose it. You guys heard that one?
Yeah.
Same thing true with your muscles, not just your brain. So pressure ulcers, right? The picture is coming after this PowerPoint, after this one, I'll tell you. So it is basically an interference with our circulation. So our blood flows through our whole body. All of you have good circulation, right? How many of you have ever slept and put your forehead on the table? And when you woke up, you had a big red spot. You have a pressure ulcer. Granted, you have a stage 1, which means it's red or a blue discoloration. And generally, when you relieve the pressure that you were putting on it with the table or your hands, the flow comes back to your head and you get good color again, right? But let's say I didn't move. I would move into a stage 2, where maybe the skin started to break down, and now I've got an open spot. And then stage 3, you're starting to see how many layers of skin do I have. You're going to learn this in anatomy here soon.
3.
Because you're getting ready to go to skin.
I think it's like what?
4.
It's more than that.
So we have about 4 layers of skin, okay? And then we go into muscle and tendons and all of those things. So your layers of your skin, you're going to bust through on stage 3. By a stage 4, you're down into you're through all the skin, you're into the muscle, the tendons, and you might be able to see a bone. Okay? I've seen all 4 stages. Stage 4 looks awful. You all ready?
Yeah.
For the ugly pictures?
I want to see 6-4.
Okay. So a stage 1, like I said, it's just a red spot. Right? It looks okay. Stage 2, it's starting to break open, looks kind of moist and wet. Right? We've all probably seen a burn or something on your hand. Those kind of turn into stage 2s. Right? On stage 3, you see how black it's turning? What's the black? It's my dying skin. Things are dying. There's no blood flow coming to that part of my body anymore. It's dying off. Turns black. Okay? And if you are naturally, let me tell you, if you are naturally dark-skinned, right? What color is your skin turning?
Pink.
White and pink, not this black color. So black is more for Caucasian, and if you're naturally an African-American dark color or even a caramel color, you're going to turn white and pink when your skin starts to die. Is it weird? That's weird, isn't it? That it flip-flops, but it does. Yeah, right? And then a stage 4, like I said, this is where you're like, it's like a hole straight down into your body. This is definitely a muscle showing. Okay?
Cool.
Cool, but do you think that hurts?
Yeah, probably. So
Yeah.
bad.
Yeah, that hurts super bad. Actually, at stage 4, they don't really notice the pain anymore. Why?
Because they're immune to it.
They're not immune to it. They haven't been through it already. Well, stage 3 is where it's hurting the most. But why? Because it's dead. What's dead? The skin around it, the muscle around it. But what's the big thing that makes you have pain? It starts with an N. My nerves. You've killed all the nerves in stage 3, so that's where it hurt the most. And by stage 4, you have no nerves left, so you don't even notice how bad it hurts.
How long of a difference is between each until you reach?
It depends on the person. So, diabetics, right? They're the worst. Diabetics don't heal at all. Any of you diabetic? Any of you know a diabetic? Okay, and do they very cautious about getting cuts and bruises and bumps and all that stuff, or do they don't care? They don't care. But when they get bumps and bruises, does it take a long time to heal them and cuts? Diabetics heal horribly. They don't heal. So as soon as they get one of these things, you might as well just cut it when it's out, because they're going to be a hot mess. They are definitely going to hit a stage 4 generally. They do not heal. So diabetics are going to transition very quick. They're going to go from a stage 1 to a stage 4 fast. and you're gonna spend months trying to fix it. Yes. You can get a major infection in this, and then your whole body can go what we call septic. So you can start an infection here, and then it goes to the whole body, or you go septic, and your organs start shutting down. So these are very serious things that can happen. Not generally what happens, but not that it couldn't. Now you and I, we're going to heal a little faster, right? Because we're young, we eat good. We're going to be a 1 or 2, and we're going to heal after a couple months. People who don't eat good, they don't take in good enough protein, that kind of stuff, they have problems. So the best way to prevent pressure ulcers is to move, right? Move around, turn your patients. When you guys sit in these hard chairs, you wiggle your butts, right? Why do you wiggle your butts around? Because your butt starts hurting and your body tells you to move. Older you get, the harder that body is to recognize those things. Or it's harder for you to move, so you don't. You move through the pain. And what happens? You get a pressure ulcer usually, right? So it's from sitting or putting too much pressure on an area. So we notice things quickly. So if you notice a red spot on someone, we try and massage it, try and release the redness, try and get the circulation flowing. If you massage something, you get blood flow to it. Okay? How many of you comb your hair and brush your hair every day? Right? For like, you're supposed to brush it for 20 minutes a day. Anybody do that?
Yeah.
Why would anyone brush it for 20 minutes a day? Well, not to keep the gnats out. I mean, that would be one thing. Yeah, but if you brush it from the scalp down for 20 minutes a day, right, it's supposed to give good blood flow to your scalp, which makes your hair grow. So people who always, what do I always get from students? My hair don't grow, Miss Roselle. I tell them to brush it. Because if you brush it and get circulation to your scalp, your hair will start growing.
Does that also have to do with thickness of the hair?
So if you brush it, there's more circulation to your hair, it works better. But you can do that anywhere. If you massage your back, you massage your feet, right, you get better circulation to them. We turn people every 2 hours. So if I'm sitting up in a wheelchair and I've been up for 4 hours, somebody had better have repositioned me at least once. Even if they just stood me up and sat me back down, they repositioned me. They got me off my butt for a second and moved me. Because every time you sit down, you sit on a different piece of your butt, right? Yeah. How many of you, when you stand up, if you sit right back down, would you sit back down in the same exact spot? No. You move a little bit, okay? We have special mattresses. We call them egg crate mattresses. They kind of like have wavy things to them. They have air in them. You can put water in them, like a waterbed type thing, right? They keep the pressure off of certain areas so that it can move around on them. The preventing of contractures, this is that tightening up. We're going to learn how to do range of motion, like 6 more weeks maybe from now, right? We're going to learn how to do range of motion. But it'll teach you how to relieve some of these muscles from stop using them. They have braces that we can use, and I've got some examples of that when we actually talk about range of motion that you can put on a patient to keep if their hand is starting to like this hand is starting to like turn in. You see how the hand is like turned in? You can put a brace on them to like pull their fingers back out and try and grow the muscle back out. Yeah.
So would that be the reason why my foot gets like that?
Why your foot looks like that? That's not your surgery? There's like a brace, maybe something to it. Let's see. We're going to talk about different ways to align your patient. I've got a little packet for your group. So when I come around, you'll know what position to put your patients in. Okay? So supine, easy way to remember this, they're on their back. So spine, right? My spine, supine, I'm laying on my back. Is everybody with me on that one?
Yeah.
You guys know my tricks, right? Lateral, they're on their side. I don't have one for that other than lateral side. I don't know, side. Could be either side. Prone is on the stomach. And I didn't have one for this, but another student told me this one. You guys can tell me if it works for you. But prone has 1 in it. And when you're 1, you're on your belly because you're crawling. It worked for them. It helped the whole class. I always say it now because it's what helps people remember. Who told you that? Gosh, that was probably 3 years ago. I don't even. I don't remember now, but I know it was a student. I remember, I can see her face. What? No. Yes, I'm almost done. Forward. So supine is laying on their back, right? Basically, how you guys lay on your back. It's not a hard thing. Lateral, and I'm going to show you these positions, is basically laying on their side. And we're going to, probably in the next couple of days, probably tomorrow. Yeah, I think tomorrow. We're going to talk about how to place some pillows and put them on their side. That's just more things about prone. If they would lay on their belly, right, you kind of want to protect their feet. So we would put, you guys all know how to lay on your belly. Yeah, I'm not going to go over how to lay on your belly. That's all right. So whenever we put a patient on there, any position, we're going to make sure they have safety things, right? Side rails, they're call light, they're comfortable. If they need their boots or something, they're on. All right, turning, okay? All I want you to know about this is how often do you turn a patient? How many hours? Every 2 hours. That's the key. That's what you need to remember. When we dangle a patient up on the side of the bed, and we're going to do this too, this is another skill. You basically, it's a patient who shouldn't be getting out of bed because they're probably dizzy or sick, or they don't feel good, and when they do stand, they pass out or something to that effect. So, we set them on the side of the bed, and we let them dangle their feet, right? It literally is what it is. We check their pulse usually when they're laying, when they're sitting, and when they lay back down, just to make sure we didn't wear them out too much. So we'll go over that when we do it too. Things to watch for when you're dangling. Are they sweating? Are they looking dizzy? You guys know what someone looks like when they're dizzy, right? They're like, you know. So we try to look on those things. When we transfer a patient, we're going to transfer, like I said, on this stretcher today for sure. And I'll show you how to do that. And then we're going to transfer soon to wheelchairs and to that blue chair in the back. We don't have any strap or mechanical lifts here. I'll teach you that next year when we go to the nursing home. So you'll be able to see that one. But this is what our lifts look like, right? I put you up in a chained machine with a cloth underneath you, lift you up in the air, or the machine does, and it moves you to wherever I want you to go. A wheelchair or back to bed. Huh?
What if they can't stand with it?
Oh, they make them pretty large now. I think there's, the last lift that I saw that I actually used held up to 1,000 pounds. So anybody know anybody that weighs more than 1,000 pounds? It's very rare. But America is becoming very obese, okay? I can warn y'all right now. Becoming very obese very quickly. So, those are just some of our tools. Are you excited now?
Yeah.
Okay. So, now what I want you to do is a couple of different things, okay? So I made a packet for each of your beds, okay? And I'm going to show you that it's got supine, okay? Everybody's definitely on supine. And did we already talk about all the different positions? Like jackknife and knee chest? How do I feel like I already did that? Okay. So, other positions, right? Supine was what?
Spine.
Laying on my back, right? Or spine. And prone was stomach. And how do you remember that? Because I told you one is on your belly, right? And then lateral, I'm on my side. Those are the three popular ones. But you could have to put a patient in a couple other positions. And I won't quiz you on these positions because I guess I'm assuming we normally have done medical assisting by now, and we haven't done that yet because I'm moving things around this year. See, I'm losing my mind. But when we get there, we're going to talk about knee chest. So if you have to put a patient in there for surgery, we'll talk about those ones. There's also Fowlers, and I do want you to know Fowlers. So Fowlers is basically setting them up in the bed, but there's low, medium, and high. So low basically means they're at 25 degrees. Medium means they're at 45, and high is at 90. 90 is more like what I'm going to feed somebody at. Lithotomy is basically, how many of you have had a pap smear? Nobody's had a pap smear? You've all seen the movies where somebody's given a baby though, right? So that's lithotomy, super exciting stuff. And we'll do those positions probably later on when we get on the table back there. Trendelenburg we won't talk about either. So today what we're going to do, right, I'm going to give you these packets at your groups just so you can look through them as a group together. And then I'm going to show you all as a group how to transfer from the bed to the stretcher. And we're going to talk about how to move a patient up in bed. And then we're actually going to position the patient on their side. So are you guys okay? Are you ready?
Yeah.
So we got a few skills we got to do. Okay?